We welcome our viewers around the world to our educational academy, where we explore the lifetime risk of maternal death, compare data from Nigeria, Cameroon, Ghana, and the United States, and discuss the global goals, challenges, and solutions that can make childbirth safer for every woman. Don't forget to subscribe, like, and share. The learning objectives are on your screen. In this video, you learn what lifetime risk of maternal death means, why it matters, and how it differs between Nigeria, Cameroon, Ghana, and the United States. We'll look at the World Health Organization Sustainable Development Goal 3.1. Explore the challenges behind high maternal mortality and highlight practical solutions and next steps to make childbirth safer for every woman. Here is the sobering news. Every 2 minutes, a woman somewhere dies from pregnancy complications. In parts of Africa, pregnancy can still be a matter of life and death. The lifetime risk of maternal death is the probability that a woman will eventually die from a maternal cause if she is exposed throughout her lifetime to current levels of fertility and maternal mortality. In simple terms, how likely is it that a woman will die from complication of pregnancy or childbirth over her lifetime? Nigeria alone accounts for more than a quarter of global maternal deaths. Causes of maternal death include severe bleeding, infection, unsafe abortion, hypertensive disorders, and lack of adequate personnel and infrastructure. Our viewers are encouraged to watch our video on this topic of maternal mortality. In the red box, we highlight the lifetime risk of maternal death in some countries in West Africa, the United States, and the global average. In Nigeria, the lifetime risk means that for every 19 women of reproductive age, one is expected to die from a maternal cause if current patterns persist. Nigeria's lifetime risk reflects both very high fertility and severe maternal mortality, meaning each pregnancy carries substantial danger. In Cameroon, the risk is about 1 in 46. Still high, but notably lower than Nigeria's. In Ghana, the risk is about 1 in 70. Still high, but notably lower than in Nigeria or Cameroon. In the United States, it is 1 in 5,200. Why is this important and why does it matter? The lifetime risk metric captures the cumulative burden of maternal mortality better than the maternal mortality ratio alone. It reflects both how risky each pregnancy is and how many pregnancies the average woman experiences. Thus, reducing either fertility rates through education, family planning, or maternal mortality through better health care lowers the lifetime risk. In this table, we highlight lifetime risk in percentages depicted in the red box. A Nigerian woman faces roughly a 5% lifetime probability of dying from maternal causes. This is close to 280 times higher than a woman in the United States. This is very alarming. Cameroon's rate is roughly half Nigeria's, aligning with its lower fertility and somewhat stronger maternal care coverage. Ghana continues to make progress through skilled birth attendants and midwife expansion. The global target from the World Health Organization Sustainable Development Goal 3.1 is to reduce the maternal mortality ratio to less than 70 per 100,000 and the lifetime risk to below 0.3% by the year 2030. The challenges shared by these countries are limited skilled birth attendants, high fertility, weak health infrastructure, poor healthcare pay leading to the jobber phenomenon, which is doctors and healthcare workers going to countries mainly in the West for better pay and job satisfaction. Other challenges include poverty and governance issues. These are the things that work, investment in education particularly for girls, investment in healthcare with a focus on better pay for doctors, nurses, midwives and other healthcare workers. Investment in healthcare infrastructure. The world pledged to cut maternal deaths to fewer than 70 per 100,000 by 2030. At current pace, that goal is slipping away. Only better leadership and investment in healthcare can change it. In summary, behind every statistic is a mother, a daughter, a family. Reducing the lifetime risk of maternal death saves not only lives, it sustains futures. The learning objectives have been met.
We hope you enjoyed this video presentation. If you found this presentation informative and educational, please give this video a thumbs up and consider subscribing and sharing with family members, friends, and colleagues. Your support helps us create more informative and educational content. Until next time, stay strong, stay hopeful. This has been a presentation of Apomulero Media LLC.